Hi, I'm Mary McQuilkin, adjunct faculty for the University of Alaska Fairbanks Center for One Health Research. Today, I'm joined by Dr. Gregory Pietsch, assistant professor of veterinary medicine for the University of Alaska Fairbanks Department of Veterinary Medicine.
I'm Greg Pietsch. I'm a veterinarian. I've got 20 years of clinical experience. I graduated from veterinary school in 2002 from the University of Minnesota and was a small animal practitioner for a number of years. I started with an internship, a small animal rotating internship in Atlanta, Georgia, and then traveled to New England where I worked in New Hampshire and Massachusetts in small animal practice, and then moved back to Alaska in 2010 and worked for 10 or 12 more years in Fairbanks before coming to teach at the University of Alaska Fairbanks. I teach a variety of subjects, a lot of the clinical small animal related subjects at our veterinary program here. And I also teach the preventive medicine class.
I know you're passionate about increasing access to veterinary care. Can you explain the impact on human populations when animals lack access to healthcare?
Yeah, that's a really good question. Access to care wasn't something I really put much time thinking about early in my career. I went to work, went to the clinic. We had clients come in, we did the things they needed. Um, and occasionally we'd run into someone who couldn't afford services, which at first just seemed like a burden on me. But as time went by, I realized that was really the wrong way to approach it. And I needed to think about how I could help people get the care that they needed for their pets. And that's something that I've seen over the course of my career as things have gotten more expensive. That's become an increasingly common problem. So just within working in various towns and cities, I see that just with people who, have jobs and go to work and have the ability to get to the vet, but sometimes can't even afford it. So that got me thinking about how can we get people where we can get care for their pets. And I would see the impact. It's really hard on someone when they have to have no care, perhaps, when they have to euthanize an animal just because they cannot afford to potentially fix something that was fixable, and it's just a financial issue. That's really emotionally hard, both on the caretaker of that animal and for all of the veterinary staff involved, the veterinarians, the technicians, um, the receptionists. It's really emotionally challenging. I've seen this more as I've gone my career, just interacting with people and seeing the situations. And as I've gone on, I've gotten involved with volunteer work. I do a spay neuter clinic here in Fairbanks monthly, and that's low cost. We charge $100 a spay versus I think a lot of clinics it may be $500 or $600. We see a lot of people who couldn't spay their dogs if we weren't there providing that service, and they are so thankful. My work involves going out to various villages around the state where it's not even a financial issue. There are no veterinarians. And the impacts you see, especially going out to the villages, the large number of primarily dogs really is a problem. They're scared of dogs. They may be bitten. They may have their fish taken or a caribou quarter taken. So now they've lost food. They're scared to go out if they're aggressive dogs. They may love the dogs, but there's too many. And it's not uncommon for there throughout Alaska to have culls periodically where people go through and shoot dogs just to decrease the population. And no matter how tough someone says they are, has a huge impact on you to shoot an animal like that or see it or know it's happening. So it causes a lot of mental health harm to people when they can't care for their animals or they see animals that need to be disposed of in ways that are less than desirable.
How does the risk of zoonotic diseases in the circumpolar north compared to urban areas in the lower 48?
That's an interesting question also. One of the big risks in the circumpolar north for zoonotic diseases is rabies. That's a higher risk than many other areas of the country that are not in the circumpolar. Of course, that depends around the world on location. There's certainly some areas that are very high. But within the United States, it's relatively easy to go get a rabies vaccine. The rabies vaccine works very well at preventing disease. In the circumpolar north, particularly on the coastlines, we see a tremendous amount of rabies in the Arctic foxes, and it has a huge impact. It's transmission from foxes to other animals. Most commonly, we worry about dogs. In the last year or two, there was actually a moose in Teller that had rabies. That was the fox variant of rabies. Rabies is a deadly neurologic disease that is transmitted from bites of rabid animals, and it effectively has no cure once you become symptomatic. We do have the good fortune now of, if you've been exposed, there are prophylactic treatments that can be given to prevent the disease from developing, but that is very involved and expensive. Many times in villages, if someone has been exposed to a wild animal or a dog of unknown rabies status, they are required to go and get rabies treatment, which oftentimes requires leaving the village. And I've heard numbers in the ballpark of costing $20,000 per incident per person when you start factoring in travel, loss of work, loss of income, everything else that's involved. So there's a huge impact there. And so one of the things we do with access to care and preventive care as veterinarians is try to set up programs where we can get out. And if nothing else, our top priority is rabies vaccines in the villages. And so that's something, when I go out to the village, we always bring rabies vaccines. And if we can't do surgeries for spays or neuters or do anything else, if we can at least do that. Alaska, and I believe Canada also has lay vaccinator programs where individuals are trained how to give a rabies vaccine properly and allowed to do that. So dogs can be legally vaccinated. That is huge at preventing rabies getting into the dog populations of the village, potential exposures to people. I should add, when a person has a potential exposure, say it's a dog bites them, if the dog is rabies vaccinated and known, that makes things a lot simpler. If there is no status with that dog, if that dog is found and known, you can test it by euthanizing the dog and looking at its brain, which is something most people don't want to be involved with. So we can prevent some unnecessary dog deaths as well as trauma to the people of the treatment.
And with animals getting potentially zoonotic diseases like rabies, is there a case surveillance or reporting system in Alaska?
Yeah, we do have reportable diseases, and rabies is one of them, and that is reported to the state veterinarian. So you can look up rabies incidents throughout the state. As I mentioned, a rabies test is sending the head of a deceased animal into the state lab, and they look at it under a microscope to find if it's infected with rabies. And so they are mandatory reporters. So at the same time, they're telling me that I've had a rabid animal, they're also telling the state. And so you can look that information up, and every state has that system. And the CDC keeps track of those numbers also. Dr. Hansen, who's one of the veterinarians here in our department, does some disease research. She's particularly interested in leptospirosis. But this summer, she was working on a project where she was trapping voles in different areas kind of around the state and testing them for leptospirosis and a variety of other diseases, just as a surveillance of what's out there. And part of her interest in using voles is they're what we call peri-domestic. So they're wild animals, but they like to be around us. And with exposure to our dogs, our cats, maybe our house, maybe our food. And so they could be transmitting diseases to us. So there is surveillance work with that going on. There are surveillance at the federal and state level for things like avian influenza, the high path avian influenza. That's a very important topic. That's an influenza that is in the wild bird population in areas like the YK Delta, which is a massive bird refuge there. Tons of migratory birds come there and nest and raise chicks in the summer. There's surveillance projects looking for avian influenza. since we get so many migratory birds here, it's really important to pick it up here because the geese, the swans, the ducks, the sandhill cranes, they're going to fly thousands of miles. Today, as we speak, I wouldn't be surprised to see sandhill cranes circling over the UAF campus as they prepare for their migration down south. And so this is how this gets transmitted. And it's a huge impact on humans in two ways. One, this has been an issue over the last couple of years. Egg prices keep going up because when we get avian influenza into a massive chicken farm that's either producing meat or eggs, they have to cull the entire farm. So suddenly we don't have as much chicken meat. Suddenly we don't have as much eggs, and supply and demand makes it more expensive. We are also seeing some crossover cases where that influenza is going from birds into other species, including humans. We've seen it in cats, cows, and it's been minor so far. But if that crosses into humans, we could have the equivalent of another COVID pandemic.
I read that the Hub Outpost Project, or HOP, was specifically developed using a One Health framework, and it was developed in partnership with YKHC, the Yukon Kuskokwim Healthcare Corporation. Can you explain more about that project?
So the Hub Outpost project is a project that was developed between UF's One Health program and the Department of Veterinary Medicine, and in partnership with Colorado State University Veterinary Program, which is who our university partners with for our veterinary school. And so the idea of that program is to increase access in the YK Delta region. And it's called Hub because it uses Bethel as a home base. And Bethel is the largest community on the Delta and acts as a hub out to different villages. So they can home base there, keep supplies there, organize trips from there. And that was designed working with the villages, making contacts, finding advocates in the villages, getting invitations in, which is very important with outreach work like that, to go in and provide veterinary care, partner with people to figure out what the needs were in the town, how best to communicate. And it goes out with a veterinarian and a group of students, either veterinary students from CSU or UAF or some combination. And they go out and work with the people. So a typical trip would involve an invitation into a community and getting things set up, arriving there either by boat or plane, whatever the best way to get to the village is, typically starting in Bethel, and bringing all the supplies needed. And we always set up a clinic to provide those spays and neuters and make it open to people and give people the opportunity to come in and talk with us, learn about it, watch what's going on, with the goal of reducing the litters of puppies so that the potential exposures to rabies is lower. Parasites are another problem I didn't mention before. We do dewormers for all of those animals as well, and that decreases the parasite burden in the dog population, which decreases the potential exposure to the humans. We also typically go door to door throughout the village. This is something the students love to do, to introduce themselves and ask if anyone has any animals that they would like vaccinated or spayed. We also do what we call the combo vaccine, which is distemper and parvo, not zoonotic, not something contagious to people, but diseases that have huge impacts on dogs and oftentimes are fatal to dogs and can run rampant through unvaccinated populations. So while not that direct health impact on people, the emotional impact of having a sick dog in your house and watching it die or having to shoot it to put it down is huge if we can prevent that. And even getting into the environmental aspect, in some areas, coastal areas, canine distemper is infectious to seals as well. And so if there's a seal rookery nearby, that can be decimated if there's canine distemper. So in those areas, having a good vaccination protocol is really important to prevent it getting into the seal population, which then goes back to the native communities there who may be relying on harvest of those populations for their subsistence.
You also do work with Veterinarians Without Borders. Can you tell us more about that?
Yeah, Veterinarians Without Borders is a really exciting group. It's the same concept of Doctors Without Borders. They go around the world providing services in countries where there's a need. A lot of their work is in Africa and Asia, and a lot of it revolves around public health and farm animal production animal medicine. So a lot of it is parasite control, vaccine strategies to help farms produce more food, help make sure that food is safe. And a lot of it is centered around education, teaching people how to do it. They have a project in northern Canada called NAHI, which is very similar to the Hub Outpost Project, or we call HOP, that we talked about before. And that's going into Arctic villages or subarctic villages and providing vaccines, providing spay and neuter services, doing outreach and education. They typically will go to the schools or host some sort of community event at the bingo hall or community center to get people involved, interested, educated about what's going on. They've been looking to expand that NAHI, that Northern Canada program, into Alaska. And at the same time they were looking to come into Alaska, the Hub Outpost Project has actually been winding down. That was been grant funded and the grant is ending. So we have been working with HOP to partner with Vets Without Borders to have them come in and sort of take over and continue and hopefully grow that HOP program so we can continue care on the YK Delta. We're going to partner with Alaska Native Rural Veterinary Program, and that's a group that's been around for many, many years providing care. And so we're looking for partnership to start trying to get people to work together, coordinate, make sure we're hitting as many villages as we can, make sure we're not duplicating efforts, trying to identify areas that aren't getting any care, and collaborating with each other to get the contacts, to get the invitations into the community, to learn the unique things about different communities. So it's a very exciting time with that group, and we're hoping to see and hear more of them as we grow in the state with that program.
Are these programs to increase access to care in rural communities able to share resources with the tribal health organizations? For example, like use a clinic building for spay and neuter services or other things like that in order to increase efficiency by cost sharing?
It really depends on the organization on what arrangements they have. And I have a goal to help different organizations start to work together and share ideas, share resources. The Hub Outpost Project has an agreement with YKHC where they can go in and use the clinics in the different villages. It's interesting that arrangement. YKHC is funded by the federal government through the Bureau of Indian Affairs. And so those clinics are for healthcare, which the federal government defines as human healthcare. Veterinary care does not count. So the current agreement is that when we go to a village with a clinic, we can stay there, we can sleep on the floor. Some of them have bunk rooms. If they're not being used, we can use the bunks. We can keep our stuff there, but we cannot do any of the care within those facilities because that would be a violation of the rules. So while we have a nice place to stay, we have to find somewhere else to do the vaccines, to look at the animals, to do the spays and neuters. That's oftentimes a community center. Sometimes it's in someone's garage. It's whatever we can find. And that's one of the things that does make access to veterinary care difficult. The human healthcare in the villages, there are these big organizations, YKHC on the YK Delta. Dozens of villages fall under its purview. There's clinics in each one of them. There's federal dollars. They have employees who are paid at the clinic. We just don't have that level of organization as veterinarians. We don't have the funding. The federal government's not funding us. I mentioned HOP has wound down because it was grant funded and the grant ran out. And so all of these organizations, the veterinary organizations, are essentially volunteers looking for money, grants. Okay, we've got a year, we've got 5 years, 10 years, whatever it is, but it's right now not sustained. We don't have the infrastructure in place. So if something happens to someone in an organization, perhaps that organization ceases service because their one key person who was really passionate about it can't do it anymore. And one of the things that has been proposed, I'm not sure where it currently stands, but it was at least in the Senate last I checked, is legislation to change the definition of healthcare with the Bureau of Indian Affairs, which would include the word veterinary in it with a One Health lens to it. And it talks about the importance of what we do as veterinarians, the impact on both the physical and mental health of people. And it's a very minor wording change that, if it ever passes, will have a huge impact because it would allow us to go to a community, use the clinic, and actually provide care for animals in a clean, heated, well lit space compared to, a dirty garage or a tent or whatever it might be. So that's something I'm really hopeful for, that we will see that wording change just to give us the ability to even do it. The next hurdle, of course, then would be funding. But right now, no amount of money would let us work in a clinic in a village.
So even if that bill passed, then you would need to change it the federal level with Indian Health Services funding regulations to then be able to utilize infrastructure and other services for veterinary care.
Yeah, I mean, that's in a nutshell. So the first step is being allowed to be there, and then getting the Bureau of Indian Affairs or other federal entities to start funding. The BIA gets money to YKHC to fund the human healthcare. I would love to see organizations like that have under their umbrella a veterinary program, because, one veterinarian and a technician or two and someone to do administrative work can cover a lot of ground. And compared to the human side of things is quite inexpensive.
Yeah, I think that's a really interesting model because I've been at a lot of rural clinics working, and like the dental team will come out, for example. And when the dental team comes out, everybody comes in from that village and is able to see a dentist. And those of us working in human healthcare just share the space temporarily while that team is in town. So it would be really cool if in the future a similar model could be implemented where veterinary care could travel out with a team and provide services in a similar way.
Yeah, I think it would be an amazing model. And I think we learn a lot from each other. I mean, I love when I talk with my physician friends, my optometrist, my dentist, and we kind of compare notes on what we do and what's similar and what's different. And it's interesting for both sides. And I think we can do a better job when we're actually talking to each other. One area where we will sometimes see disagreement between human physicians and veterinarians is toxoplasmosis. And that's something that cats get blamed for. It's something that cats can have. It's shed in their feces. It doesn't typically cause severe disease. Most time it's some transient diarrhea, but it's zoonotic. People can get it too. Again, usually not a huge big deal for people, but it is a huge big deal for pregnant women because it can cause abortions. And I see less of this, but physicians are often taught or often think, well, you get it from cats. And so if you don't have a cat, pregnant women can never get it. And so we've seen pregnant women be told, well, you have to get rid of your cat. We generally, in most cases, I would say, no, don't get rid of your cat. It's transmitted in feces. The vast majority of cats don't have it. They maybe got it as a kitten and it was transient and they no longer have it, but they have antibodies for it because they were exposed. So we can't really test to screen them out. But most cats don't have it in the first place. It's a protozoal organism. It comes out in the feces. It has to sporulate and become infectious. That takes 24 hours to happen once it's left the cat. So we recommend just scoop the litter box daily. It takes 24 to 48 hours to become infectious in that feces. So if you keep the litter box clean, you're getting rid of it before you can get infected. We also recommend wear gloves and wash your hands because it's fecal oral contamination. So if you're not putting the poop in your mouth, if you don't have it on your hands and ingest it, you're not going to get it. And further, when it's possible, we recommend someone else in the house who's not pregnant just scoop the litter box. So that's oftentimes make the husband do it. Wearing gloves, washing hands, cleaning it daily, and being good about that. Very, very little risk. No need to get rid of your cat. And so the conversations when we work together and we share this knowledge and each talk about our concerns, we can come to better solutions.
Do you know if there's a lot of cases of leptospirosis from seals and sea lions in Alaska?
I don't know that off the top of my head.
We had it in California. That's why,
Yeah,
no, it can be a big problem, and that would be another route potentially for Alaskans to get exposed.
I can ask about that because I suspect that is something that people are looking at, but I don't know. But if I can find an answer, I'll get it to you.
Can you think of any examples of how you use epidemiology in your work?
I think it depends on the work I'm doing, like the location, and that drives my concern level and what I focus on as a priority. For instance, here in Fairbanks in the interior of Alaska, when I'm working in clinics and we're doing vaccines, we rabies vaccinate. It's legally required, but we have very low risk. If someone's overdue on a vaccine, well, it legally could cause some problems. The chances of getting that animal getting exposed to rabies here in the Fairbanks area is extremely low compared to if I'm out on the coast somewhere where there's a tremendous amount of rabies. That's my top priority is where you get rabies in now on this one day I'm here. Probably the biggest thing that affect is what population am I in, both with people and with animals and the different exposure rates, similar to parasites. I don't think about parasites a lot here when I'm working in town. We probably are deficient in the amount of surveillance we do here in Fairbanks and probably many other urban areas of Alaska, because overall, we don't have a very high parasite burden. When we're in clinic here, it's pretty exciting if we find roundworms or if we find fleas or ticks. Those are almost unheard of here in Fairbanks. Those things are very exciting. So I don't think a lot about that. We don't prescribe monthly heartworm or flea and tick preventative in most places here in Alaska. When I go and work in the States, those things are really essential. We've got ticks in many places. They transmit all kinds of infectious diseases. The most commonly known one is Lyme disease that most people are familiar with. Fleas are everywhere. No one likes fleas. It makes the dogs itchy. They infest your house. They get on you. They make you itchy. They can also carry infectious diseases. So those prevalence of those diseases, depending on location, is a huge impact on what I'm doing on a daily basis, my recommendations to my clients. And in the villages, like here in Fairbanks, super rare to see intestinal parasites. You see them a ton more out in the villages because those animals are out hunting or foraging far more often, being fed perhaps raw game meat or undercooked game meat versus our animals here in town who are largely being fed commercial cooked diets.
How is data on vaccination rates collected for animals in Alaska?
I don't think that there is a universal database of that. It's not something that is necessarily reported here in Alaska. Small animal clinics don't share that data with any governmental organization. Some areas in the States, there's licensing requirements. There may be some in Alaska that's not in Fairbanks, but perhaps somewhere in Massachusetts, you have to have a dog license from the town or the county. And to get that, you have to show a rabies vaccine. So they've got a record of rabies vaccines. In most places in Alaska, we have nothing like that. There is the lay vaccinator program, and I suspect, I don't know for sure, that they would report how many vaccines they are doing in villages, but it's still kind of raw numbers. We don't know what the population of dogs is in different areas of Alaska in any given time. There's no one to do that work. There's no money to fund it to do the survey to know. Akiak has 300 dogs and Calskag has 100. And with the rate that dogs can reproduce, those numbers can change rapidly. So some of that basic epidemiologic data of knowing, we've got a 10% vaccination rate or a 90% vaccination rate is really hard to know.
Greg, thank you so much for taking the time to talk to me this morning and sharing your perspective as a veterinarian with One Health students.